Hi everybody, today we're going to talk about somatic symptom disorder, or SSD, what it is, and most importantly, if you recognize yourself or somebody you love as potentially having somatic symptom disorder, what should you do about it? Stick around, I'll give you some tips. So the term somatic really just means physical. So we're talking about somatic symptoms, we're talking about physical symptoms. They can be very specific, like a headache or a stomach pain, and they can also be very general, like a sense of nausea, a general sense of weakness or exhaustion. Now, the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, more commonly known as the DSM5, has 2 criteria that a person has to meet to be diagnosed with somatic symptom disorder. Now, criteria A states that the person has to be having physical symptoms, and the physical symptoms have to be distressing enough that they are really impacting the person's daily life. If those symptoms are more neurological in nature, say the person is having a lack of consciousness, seizures, distorted sensory symptoms like impaired vision or abnormal body movements, then it's more along the lines of perhaps a conversion disorder, also known as functional neurological symptom disorder. And I do have a video for that, and I've put the link in the description box below in case you want to check it out. So if we're talking about physical symptoms here, what is it about somatic symptom disorder that makes this a mental health problem? Well, the answer to that can be found in criteria B. So you have to be experiencing at least one of these 3 to be diagnosed with somatic symptom disorder. So first, you may be experiencing constant and excessive thoughts about your symptoms, about what the meaning of these symptoms could be. You may also be dealing with persistent anxiety and worry about the symptoms. And you may be spending a lot of time and energy dealing with the physical symptoms as a result of them. So the severity of somatic symptom disorder can go from mild to severe, and it's really based on how many of criteria B are present, also how many physical symptoms that you have, and how severe those symptoms are. Now, here's how I like to remember the idea of a disorder when we're talking about mental health. The symptoms the person is having are extreme enough that it is disrupting the sense of order in multiple areas across the person's life. So we are impacted in our school, at work, in our relationships. There is an overall sense of disorder as a result of the symptoms we're having. So let me give you an example of somatic symptom disorder. Let's say that I'm experiencing chest pain, and I start to really believe that this chest pain is an indication that I am on the verge of a heart attack. I go online, I start researching this chest pain, and I find all of these horror stories that confirm my biggest fears. I go see a doctor, I undergo numerous tests. Maybe I go and get a second opinion, a third, a 4th opinion, and no matter how many doctors tell me that my heart is fine, I am not reassured. Despite what all the doctors are telling me and what all the tests are showing, I start to make some big changes in multiple areas of my life. Let's say I stop working out because I'm afraid that getting my heart rate up is going to induce a heart attack. I stop going to work because the stress of going to work could induce a heart attack. So you can see that when multiple areas of my life are uprooted, then it becomes a case of somatic symptom disorder. But to be clear, I'm genuinely having these physical symptoms. The chest pain is legit. If there were no physical symptoms, or if physical symptoms were very minor, it wouldn't qualify as somatic symptom disorder. It'd be more along the lines of potentially an illness anxiety disorder, also previously referred to as hypochondria. So if that's more what you're looking for, then I have a video on illness anxiety disorder, and again, you can find that in the link in the description box below. Chronic worry, anxiety, or depression affects the body in the sense that we experience more physical tension, more muscle tension, more muscle tissue is affected, and that can legitimately increase the amount of physical pain that we're in. And of course, because the physical pain is heightened, we experience more worry, more anxiety, maybe more depressive symptoms, and you can see how we can get stuck in a vicious cycle, even going in circles with medical doctors, if we don't appreciate the impact that mental distress truly has on the body. get a team around you that includes your medical doctor, a psychiatrist, and a therapist. Going to visit your medical doctor, following their recommendations about follow-ups and preventative care is going to help you deal with the anxiety and those excessive thoughts you may be experiencing. Seeing a psychiatrist can be really useful, and getting a recommendation about potentially using pharmacology to deal with some of the underlying anxiety or depressive symptoms that may be impacting your body physically, leading you to experience increased amounts of physical pain. And finally, working with a therapist to relate differently to mental distress. So using evidence-based approaches like cognitive behavioral therapy, for example, learning how to manage that relationship with thoughts and emotion, which is another reason why mindfulness can be very helpful. With mindfulness, you are truly learning new skills for dealing with those anxieties so that they have less impact and influence over your behavior, over how you spend your time every day. Finally, Gestalt techniques, a Gestalt approach to dealing with somatic symptom disorder can be really useful. If these symptoms are not here because of the medical condition you originally thought, then what are they here to potentially tell you? You can learn a lot about your physical symptoms and what they might mean and the messages they might have using Gestalt techniques with the help of a therapist. Hit the like button if you liked this video, and please subscribe if you want to see more from me in the future. This is a very new channel, and so you might be new here. I want to thank you for sticking it out till the end, and ask that if you do have any questions about somatic symptom disorder, or if you've experienced this yourself and you're willing to share a little bit of your story, that you leave any of that in the comments below. It just makes this topic, this video, even more helpful for other people who come here. All right, have a good one.